Chapter 41, The Child with an Infectious Disease, continued. The incubation period for pertussis is 6 to 20 days, with the infectious period being 1 to 4 weeks. It's transmitted by contact to respiratory droplets from coughing. There is a vaccine for it. Can occur at any season, but most usually is in the summer and fall. There are 3 stages that are catarrhal, paroxysmal, and convalescent, and they last a total of 6 to 12 weeks. See box 41.1 for details of each. Diagnosis is made through a positive nasopharyngeal culture. The most common complication is pneumonia. Other respiratory complications can occur as well. Malnutrition and dehydration can occur and can be dangerous. Primary prevention of pertussis is the best therapeutic management. Erythromycin, azithromycin, or clarithromycin is given during the catarrhal stage, which will eliminate the organism from the nasopharynx within 5 days. Hospitalization and supportive care for the infant may be needed, especially for infants younger than 6 months. Nursing consideration is a thorough history, including immunizations and exposure to the illness. Also get a good description of any respiratory events prior to the admission and the symptoms they experienced. The child's respiratory status needs to be carefully monitored. Suction and oxygen should be available and used as needed. Monitor the child's nutritional status and encourage small, frequent feedings and meals. IV fluids may be needed if the child is at risk for dehydration. Resting is important, so clustering care to allow for this is important. Incubation period for scarlet fever is 1 to 7 days with the average of 3 days. Infectious period is the acute stage until 24 hours after microbial therapy has begun. Transmission is via airborne or direct contact. There's not a vaccine for this. Most common in the later fall, winter, and spring. Manifestations include abrupt fever, vomiting, headache, abdominal pain, pharyngitis, and chills. The fever reaches its peak by the 2nd day but returns back to normal within 5 to 6 days. Within 24 hours, a fine red papular rash appears in the axilla, groin, and neck, which feels like sandpaper to the touch. Desquamination may begin on the face at the end of the first week, and flaking will proceed down the trunk. The tongue is initially covered in a white furry covering with red projectile papillae. By the 4th day, the papillae slough off, leaving a red, swollen tongue. The tonsils are edematous as well. Complications result from extension of the streptococcal infection, which can include otitis media, peritonsillar abscess, meningitis, rheumatic fever, and glomerulonephritis. A rapid streptococcal screening and/or throat culture to confirm. The preferred treatment is penicillin and, if allergic, erythromycin. They may return to school or daycare 24 hours after beginning their antibiotics. Droplet precaution should be used until the 24 hours after the start of antibiotics. The nurse needs to get a complete history, including symptoms and when exposed, assess the child's tongue, rash, and vitals. Comfort measures include encouraging fluids and administering any antipyretics that are ordered. Analgesics may be given for discomfort, bed rest, and quiet activities during the acute phase. Lyme disease incubation period is 1 to 31 days. Transmission is by the bite of an infected tick, and peak season is April to October. It's a multi-system disease. It is divided into 3 stages: early localized, early disseminated, and late disseminated. The skin lesions are most prominent in the first stage. During the 2nd stage, cardiac and neurological findings are prominent, and in the 3rd stage, arthritis is the main symptom. In the early stage, they will also experience flu-like symptoms and erythematous macule or papular forms at the site of the tick bite within 1 to 31 days. The rash can look like a bullseye appearance and will last about 3 to 4 weeks. About 1 to 4 months after the bite and during the 2nd stage, the neurological signs can appear. This includes headache, nausea, vomiting, Bell's palsy, or forgetfulness are a few of the common symptoms. Joint pain can occur and is typically in the larger joints that are affected, and it will last a few days but can reoccur. During the 3rd phase, which can be months or years after the initial bite, the symptoms can be Intermittently include chronic arthritis, fatigue, and chronic neurological manifestations. Prevention is the key to therapeutic management, which includes anticipatory guidance on avoidance of the tick bites. Early identification and treatment is needed as well. Antibiotic treatment is commonly used with doxycycline, amoxicillin, or cefuroxime are the main medications used. If the disease is caught early and antibiotic treatment is followed, the disease may not progress into the other stages. Nursing consideration is a complete history and physical, when the exposure occurred, onset of symptoms. The ticks have to be attached for more than 36 hours to transmit the disease, so education to parents on checking children frequently can decrease the risk. Instruct on using appropriate insect repellent and outdoor wear to help prevent. Helminths are worms that live as parasites. Common types include roundworm, pinworm, tapeworm, and hookworm. The roundworm is transmitted by the ingestion of eggs from contaminated soil or food that is transferred to the mouth from fingers, toys, or other vectors. Symptoms include abdominal pain or distension, vomiting with bile, staining, and is diagnosed by a fecal smear. Pinworm is transmitted by ingestion of inhalation of eggs, transfer from hand to mouth. Symptoms include nocturnal, anal itching, and sleepiness, and diagnosed by the tape test and microscopic examination. Tapeworm is transmitted from ingestion from handling or eating infected beef or pork. They can be asymptomatic, but segments of the worms are seen in the stool. They could have abdominal pain, nausea, anorexia, weight loss, and insomnia. It's diagnosed by a fecal smear or microscopic examination. Hookworm is transmitted by skin penetration from direct contact with contaminated soil. Symptoms include dermatitis, blood loss, leading to anemia and malnutrition, diagnosed by fecal smear or microscopic exam. Treatment includes administration of oral medications that is for this specific helminth. Treatment is for the whole family. Anticipatory guidance on the prevention of the spread of disease is personal hygiene and sanitary practices. Nursing consideration is to obtain a thorough history, include hygiene habits and the availability of running water and bathing, what do they have for laundry facilities, and also their nutritional intake. Clear instructions on how to collect a stool sample is needed. Education to the parents and caregivers regarding proper medication administration and compliance. Teaching on primary prevention measures as well. Chlamydial infection has an incubation period of 7 to 21 days. It's transmitted via birth if the mother is infected, also through sexual activity. It's the most prevalent STI. Many people have no or just a few symptoms, but it can cause urethritis and pelvic inflammatory disease and can go undiagnosed until these complications occur. Neonatal conjunctivitis develops anywhere from a few days to several weeks after birth and manifests with a watery discharge that becomes purulent. Eyelids will be edematous. Urethritis, urinary frequency, and macropurulent discharge may indicate a chlamydial infection. If this is found in a younger child, then there could be possible sexual abuse. Therapeutic management includes 14 days of oral erythromycin for infants with conjunctivitis and pneumonia. Nurse will educate on the importance of treating all sexual partners and avoid intercourse for 7 days and until the symptoms have resolved. Gonorrhea has an incubation period of 2 to 7 days and is transmitted via intimate contact. It can be transmitted via prenatally, sexual abuse, or voluntary sexual activity. Ophthalmia neonatorium is the most common type of gonorrheal infection for infants. It starts developing in about 2 to 5 days after birth. The eyes will have a thick purulent discharge and if not treated will lead to blindness. Girls with gonorrheal infections have a purulent vulvovaginitis and the boys often can have urethritis. Many times burning with urination will be present. A serious complication includes PID, Hep B, HIV, Syphilis and chlamydial infections are also present in people who have gonorrhea, so checking for those is part of the therapeutic treatment. Sexual partners should be treated as well. The incubation period for herpes simplex virus is 2 to 14 days and is transmitted via direct sexual contact with an infected person. Herpes simplex virus 2 is a predominant cause of genital herpes. It's one of the most frequent STIs. If it's transmitted to a newborn via vaginal delivery, it can cause multi-system problems. At the initial infection, lesions occur in the genital area, mainly on the vulva, perineum, or perianal area. They can also occur in the vagina and on the cervix and not seen. Pain and tenderness in the affected area is common when the lesions erupt. Sometimes flu-like symptoms can happen with the eruption. After the initial acute phase, the virus can remain dormant, where it can reappear with triggers of stress. There's no cure for the virus, but administration of acyclovir can diminish symptoms and the shedding time. Infected neonates are treated with parental acyclovir, and if they are experiencing ocular involvement, they will receive a topical ophthalmic. Adolescents are treated for 10 days with acyclovir. Infected individuals need to refrain from all sexual contact until the lesions are healed. Incubation period for HPV is 3 weeks to many months and is transmitted via sexual contact or perianal contact through delivery. It is responsible for the common wart and for genital warts. The anogenital warts begin as small papules that grow into soft clustered lesions, typically found in the labia minora, vagina, cervix, anus, rectum, and glans penis. In many cases, genital warts will resolve spontaneously within 1 to 2 years. Treatment becomes difficult due to location, but topical gels or creams can be used. Also, cryotherapy or laser treatment can be used. Transmission can be decreased with the use of a condom, and there is a vaccine for HPV.